Hey everybody, Sean Keating here. I want to welcome you to this week's episode of the Dental Up Podcast, brought to you by Keating Dental Arts here in beautiful Irvine, California. This week we have a very passionate implant specialist joining us to discuss different types of implants, 3D printed surgical guides for implant dentistry, how to deal with difficult cases, and how a laboratory can improve your implant dentistry. Please welcome Dr. Jerome Smith, practicing all the way in Lafayette, Louisiana. Hey, Jerome, what's up, baby?
Thank you, Sean. Thanks. Good to hear from you. Good to hear from you.
Oh, dude, you're the man. I mean, you really know your stuff, dude. And I've known you probably.
I'm old. I'm getting old.
Nah, you're still a puppy, dude. I mean, and you look young, and you look like that old Hollywood movie star type.
I still feel like a young dentist, but I realize, there was a time when we were doing composite resins where we would mix a base and a catalyst together and inject it into a hole and hold a Mylar strip on it for 5 minutes and wait for it to set up.
Oh, no.
So I started practicing before the lights came out. and then Nuvafil came out and we had a light and that was cool. But back then, it was pretty much amalgams and gold crowns and occasionally porcelain fused to metal crowns and partial dentures and dentures. That was dentistry.
Yeah.
And you look at it now and it's changed so much. It's mind boggling.
Oh, it's just going so digital. Even too with impression material. I remember back in the day, Improgum, you had to do that base and catalyst and mix it on a little tray.
Right.
And
well, we use rubber base.
Yeah.
Rubber base with a spatula.
That's the nastiest stuff.
You get it on, you look like poo-poo, dog duck.
Oh, that shit never comes off. It's like,
never. And so looking at what's going on now, it's just amazing, just how much things have come along. I think about, I started doing implants in 1985. So that's,
God, that's when I started dentistry, 84, but it's just, you've been doing it so long. You're just such a man in implants. So you've been doing it 30 some odd years. I mean, that's just crazy.
But it's so cool to see how much it's evolved. And here we are now able to, we have a CAT scan machine in the office, and then we're able to digitize a model and stitch those together and create a surgical guide. I just got a Forms Lab printer. Before that, my partner, Dr. Domang, and I have these two Robox cell printers, and we decided we wanted to, go from a Volkswagen to a BMW. Yeah. So now I have the Forms 2 Lab printer. In fact, when I was talking to Eric the other day, getting ready for this podcast, he said, I can hear your printer printing in the background.
That is so cool. You're more advanced than I am, man, getting all those printers. I mean, I got a couple printers, but dude, that's freaking huge, man. That's so cool.
Well, you know what? After eyeballing implant placement all these years, you feel a little reluctant to move up to the next level. But once you do, it's like I could never go back and do it the other way.
Oh, I bet.
Because it cuts down on our time. Placement is just so much more accurate. It's just it's slick. It really is slick.
That is so cool, dude. You got any tips just for some dentists out there thinking of starting their own practice? What do you think for them is their best thing? Not buying all the equipment or buying some stuff, get a cone beam or wait and get, what kind of advice can you give some of the younger guys that listen to me on this podcast?
Well, the best advice that I have is quit listening to all the negative crap out there about corporate dentistry and about debt and how am I going to pay this off and all that. Listen, every one of us, most of the guys that I know, when we got out of school, we were broke. Yep. And we stayed broke for 10 years. And that was just the way it was. And our expectations perhaps weren't as high as maybe the millennial expectations are. I'm not really sure how to phrase that.
Yeah.
But what I'm saying is there was a time after 4 or 5 years into practice where my wife said, am I going to have to work? I said, well, yeah. How long? Probably forever. And we just winged it for 10 years. And at some point in time, you start develop enough of a following, and you start developing enough business sense and efficiency, and all those things start to come together, and then some of that debt gets whittled down.
Yeah.
And assuming that you don't go out and buy brand new BMWs and $1 million house and things like that, there's a very, very bright future for all the young dentists nowadays. They just need to know that it's there. And what I find is the harder you work, the luckier you get. And
absolutely.
There's all this stuff about marketing and social media and ads and all this kind of stuff. But sometimes it's to the exclusion of really good internal marketing, which includes being able to take photographs on patients and show them in an effective fashion what you can do and raise their value for what's available nowadays. A lot of times I find that young dentists as well as people in my generation will look at a patient and think, well, they don't want that, or they just want two implants and an overdenture, and don't even offer them the opportunity to have what you and I would have, and that would be 4 to 6 implants and fixed bridge work. They won't even offer them that because they feel like it's going to be too expensive. So along those lines, what can we do to try to bring the cost down? Mm-hmm. And one of the things we can do is quit being so damn inefficient at what we do. And that's why I think, I have a passion, and so does my partner, Dr. Domingue, about doing guided surgery, because it absolutely cuts a lot of time out of the procedure, and it allows for more accurate placement, and it allows for an easier restorative job. God knows it makes your job easier.
Oh, it does. Sure. We do so many different implants with different guys. When it comes with your practice, you've taught us so much in the past, and, I'm still a dinosaur. I'm an old school guy, and I don't even, you work with Steve here and Bob and these guys, and they just sort of rave about you, and just you make it easy.
One of the things that I think has happened is what we see is we see the industry moving toward all on 4 or all on 6 and a full zirconium restoration that screws into place. I'm not saying there's anything wrong with that. I'm saying that you've been in this business long enough to know that we kind of need to proceed with caution.
Yep.
When Howard Ferran interviewed Carl Misch before Carl died, he really had some concerns about those type restorations, those little bitty tiny screws that are holding in, a full arch restoration on 4 implants or 6 implants. I mean, the mouth it's a brutal environment, and everything looked like Paul Thorne, the singer from Picayune, Mississippi, says, everybody looks good at the starting line. All this stuff looks fantastic the day you put it in.
Yeah.
I want to see what it's going to look like in 10 years.
Oh, yeah.
That's my focus, because when this stuff comes back to you, and believe me, after doing this for 30 years, this is like a repair shop over here.
Oh,
between my patients and patients from other practices and people that come in from out of town that move to this area, if they got something broken or unscrewed or snapped off, they wind up over here. So we see it all. And what you learn from that is we need to not under-engineer. We need to over-engineer a little bit, or at least err on that side be cautious on that side of the coin, and really start looking at these things in terms of durability and long-term. And that's probably my greatest fear right now, is that some of the stuff that's being advocated, being done, is going to wind up in litigation, or is going to wind up with some unhappy dentists and patients.
Oh, I bet. And a lot of them should be doing certain things. Well, that brings me, tell me, what's the difference between all-in-4 implant, screw retain versus custom abutments and conventional cemented crown and bridge work? I mean, it's just everyone's different. Every patient's different. What do you like more than the other?
I just find that maybe it's because I've been in practice for so long that, to me, if I've got 4 or 6 custom abutments in an arch, usually 6, sometimes 8, and I've got custom abutments that have been designed by you guys using a computer, using the parameters of where the final restorations are going to be, and these things come in and we screw them into place, and now we've got 6 or 8, it look like beautifully prepped parallel crowns, and we're taking conventional crown and bridge impressions, and then we're breaking the case up into components where maybe we've got 2 posterior 3-unit bridges and maybe 2 anterior 3-unit bridges or 1 anterior 6-unit bridge. If something happens to one of those legs, we can deal with it, and it doesn't affect the entire prosthesis.
Oh, that's so on the money, dude.
Well, I'll tell on myself. I have a patient right now who we placed 4 implants, and we did a full arch restoration. And lo and behold, she comes in one day, and she's got about 50% bone loss on number 19. Oh. I don't know why. I really don't know why, but there it is. Yeah. And so now what we had to do is section the bridge at the distal of number 22 and take that implant out. And I'm going to have to go back and put one where 19 and 21 are, and then make a 3-unit bridge. But I mean, the whole restoration's tied together.
Yeah.
And it'd have been a much better situation if it was more implants and then broken down in